Dear colleagues and friends, dear ladies and gentlemen, it's a great honor to opening this webinar here today about diabetes and dementia. I'm Peter Schwarz, I'm Professor for Prevention and Care of Diabetes, and I'm President of the International Diabetes Federation. In the IDF world, globally, with people living with diabetes, dementia and diabetes is more and more recognized as a comorbidity and as an actually interconnected disease. How can we explain this? We know that eating a lot of carbs, especially eating fried carbs, is one of the main determinant of developing diabetes. There's very recent research shows that around the nerve, not only the protein plaques, but also change of glycogen around the nerve trigger the development of dementia. Where is this coming from? If we eat a lot of carbs, especially if we eat fried carbs, this glycogen is getting stored and stored as an excess glucose we are incorporating in our body. And mainly it's stored in the liver. And by using glucagon, it can be withdrawn from the liver as well. But if we consume excess glucose, it's also stored in other tissues. And as more glucose is stored, it's becoming glycogen, and then glycogen change. And this might be one of the trigger of developing dementia. This is actually very helpful to improve the understanding of the triggers of dementia to develop strategies for the prevention of dementia, prevention of diabetes, and by this, prevention of dementia. And healthy lifestyle, the reduction of carb consumption, the reduction of consumption of fried carbs, also including fasting strategies, could be a strategy against diabetes and maybe also against dementia. So what you will do in the next hour is discussing this, the pros and cons, the pathophysiology, how is the interconnection, what can we do to improve the quality of life for our patients. We never should forget that having dementia, it's a big burden. It's a big reduction for the quality of life. It's a big change also for the whole family environment the patient or the person living with diabetes and dementia is living in. And that's why we should do whatever we can do and join our forces to prevent dementia, to prevent diabetes, and by having the right intervention to prevent both from developing. It's a great honor to open this webinar. I wish you a very good webinar, and I wish you that you can translate the passion and interest in this topic into action later on for people living with diabetes. Thank you very much for your action.